views and opinions expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
Good evening. I am Errol Schneer, Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, to HealthBeat, and we encourage you to please continue participating in the program by calling 718-960-7241 with any healthcare questions you may have. That's 718-960-7241. As always, we promise to do our very best to keep you medically informed and healthy by discussing the medical topics that are of interest to you, our viewers, and the community. Please tune in every Monday evening from 6:30 to 7 p.m. on Channel 67. And you can also find out more information about Bronx Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx Lebanon's Vice President and Medical Director, and I will be discussing the role of surgeons in our healthcare system, with an additional focus on what patients need to know prior to and following an operative procedure.
Yes, Errol, surgeons and the procedure performed by them can range from routine to highly complicated to emergency life-saving situations with the end result often successful outcomes. Joining us this evening are Dr. John Cosgrove, Chairman, Department of Surgery, Bronx Lebanon Hospital, as well as Sandeep Sainathan, Chief Resident, Bronx Lebanon, and Dr. Saeed Razi, Junior Resident, Bronx Lebanon. Each of them will provide our viewers with their expert commentary and perception relative to the surgical field and, for that matter, for the entire healthcare community.
Okay, now before we hear from our panelists, let me once again encourage you, our viewers, to call in with any questions or comments you may have. The number to call is 718-960-7241. That's 718-960-7241. And please call us. Now let me start the program, Dr. Cosgrove, by asking you to provide our viewers with a general overview of the surgical services offered by Bronx Lebanon.
Yes, Mr. Schneer, the Bronx Lebanon Surgery Department is a comprehensive one that provides not only emergency trauma surgery and acute care surgery, which would consist of patients who have acute emergencies like appendicitis and abdominal problems, including small bowel obstruction, but complex elective surgeries that may be incisional hernia repairs, breast surgery, vascular surgery, plastic surgery, as well as urologic surgery.
So you pretty much do mostly all types of surgery?
We do everything but heart surgery. In fact, we've even begun a neurosurgery program recently at Bronx Lebanon.
Okay.
Okay. Expanding a little on Mr. Schneer's question, now would be a good time to ask our residents to describe their prospective roles. Also share with our viewers a typical day at Bronx Lebanon. Sandeep, you come to work late, don't you? What time do you come to work?
So our day starts pretty early in the morning. I'm Dr. Sandeep Sainathan. I am the Chief Resident in Surgery. Our typical day starts around 5:30 to 6 in the morning, where we round on the patients, and after that we exchange information from the night team, and then we have a rounding with our attendings, and then we spend time in the operating room, and our day pretty much concludes by 5:30 to 6 in the evening. By that time we had seen our patients again, and then any change in plans or whatever plans we made early in the morning, we make sure that those are done and completed for the day.
Do you ever work at night?
We have a night float system, so we have another chief resident who takes care of patients in the night in constant consultation with attending on call, and so that there's continuity of care both morning and evening 24/7.
Saeed, where do you fit in on this?
So as Dr. Sainathan mentioned, we start our day around 5:30. As a junior resident, my job is to follow up on the patients
Follow up the orders that they gave you.
All the orders, all the labs, all the investigations that we are carrying on in the whole management of the patient, pre-operative care, post-operative care, and get everything ready before the sign-out process, which is the exchange of information between the night team and the day team, which happens around 6:30. And then carrying out most of the housekeeping work on the floors, coordinating with different departments, such that whatever plan we discussed on in the morning sign-out is carried out by the end of the day.
Okay, now perhaps some further clarification is needed for our viewers. In terms of the role of the resident in the healthcare system, how would you describe it? Why is it so important, both in terms of medical practice as well as for the patients themselves? And I'll start with you, Dr. Sainathan.
Sure. Our role is graduated. As we start as a junior resident and as years pass and we become more seniors, we get increasing responsibility of taking care of patients on a day-to-day care basis. It's in very close and constant supervision of the attending surgeon, who is ultimately responsible for the care of the patient. And the practice of surgery needs to be learned over a period of few years, and that's what our attendings impart to us, so that when we graduate at the end of the day, we can independently take care of these patients. As for the advantage of having surgery residents is there's always a doctor available in the hospital constantly. Patient get far more supervision. There's so many layers from junior to senior residents. So if any patient is not doing well post-op, it's going to get more likely whatever is going wrong is going to get picked up much earlier in a teaching institution than an institution which is not teaching.
So a residency program at any hospital
Sure.
is an excellent sign for the consumer.
That's correct.
That high quality care is being offered.
That's correct.
Would you say that's an accurate assessment?
I agree with that. There are different kind of programs, university program and community with university affiliated programs.
Right.
But the general consensus is that in all the programs there is certain level of supervision, and all the activities of the residents are monitored.
Right.
Dr. Cosgrove, can you describe the process related to how patients first come to their surgeon, such as yourself, as well as to explain the terms elective, non-elective situations, and give us an example of a couple of these?
Okay, Dr.
Elective, so.
Many of our patients get referred in from Bronx Care, so we get direct referrals from the Bronx Care system when a patient calls the hospital, and they're appropriately sent to the specialist. And in our case, as general surgeon, we would give a patient an appointment within a day or two to see us, and then we sit with the patient and their family. And if it's a surgical problem that is elective, in other words, it can wait for a few days or a week, we go over the risks and benefits of the operation with the patient. We speak to their primary care doctor to make sure that they're medically okay for the surgery. And if it's, for instance, a gallbladder problem, we would book the surgery within a week or so for same-day surgery, and then have the surgery.
It's an elective case.
Elective case and go home. If it's an emergency, they generally come through the emergency room, and the residents like Dr. Razi would see the patient initially, junior resident, and then Dr. Sandeep Sainathan, the chief resident, would get called, and then he would call the surgical attending, and then we would do the surgery within a very short period of time, depending on the type of emergency.
Okay, all right. So give me examples of elective and...
Sure. So somebody coming in, say, to the emergency room with abdominal pain, most likely would get a CAT scan, and we see a lot of patients who have appendicitis. The diagnosis is generally made within an hour of them coming to the emergency room. The surgery would be booked shortly thereafter, and then the attending surgeon would come in and do the surgery with the resident.
What about emergent cases?
A real emergent case is like a trauma case. We handle some trauma cases at Bronx Lebanon, and we handle them well. Generally, the patients would be quickly triaged and resuscitated in the emergency room and brought up to the operating room within 15 to 20 minutes.
And elective cases?
And elective cases would be patients who have breast problems, plastic surgery problems, colorectal problems, get referred to the surgeon within the Department of Surgery, and then that case is usually booked within a week or two.
Now, on many of the, I direct this to all three of you, on many of the popular television programs, the medical programs, we often see scenes where groups of doctors are huddled with residents surrounding a patient. Is this an accurate assessment of what happens in a hospital? And if so, how beneficial is that to the patient?
Yes, it is. We do rounds with the residents. The residents round among themselves, and they also round with the attending physicians like myself. And we go bedside to bedside with the resident staff to see and evaluate the patients and entertain any questions they or their family members have about their condition.
So,
Does anyone speak to the patient?
Absolutely.
Yeah. Actually, they get spoken more than once. That's an advantage of a teaching institution, because if a patient doesn't reveal or has some reservations of revealing some information initially, he gets repeatedly questioned by the resident, the junior resident, the senior resident attending, and so we tend to miss very few things in the end of the day.
So now, how often do you do this? Go from bed to bed? Is it twice a day, 3 times a day? How does it usually work?
Predominantly twice a day, unless a patient has some specific problems, then they would call us to the bedside, and then we try to address their problems at that time.
So the fact that all the people are around the patient is a very positive thing.
That's correct.
That people in our viewing audience can look at as a
That's correct.
a benefit to the
Sure.
system.
Expanding a little on Mr. Schneer's question, let me ask you, the residents, to explain the importance of your residency. What you came from medical school,
Sure.
what have you done since then, and why do you think it was worthwhile? Let me ask you first, Dr. Rising.
So I am originally from Pakistan. That's where all my basic education, including medical education, is from. I came over here. I did some translational research in lung cancer before I started my training.
Yeah.
Initially, I was in Connecticut, then I moved to Bronx, Lebanon. I believe that the training in United States is far superior and more in accordance with what the current literature suggests and more evidence-based. So in a program, with a surgery program, as you go up the ladder of residency, you do get more experience, and ultimately the decision-making process is on you compared to the junior.
Dr. Nathan, what have you learned since you came to Bronx, Lebanon? And where are you going afterwards? You're finishing in a couple of weeks, right? A couple of months?
I will be finishing in the June of this year, and I'm pursuing a 2-year fellowship in cardiac surgery. That's what I intend to do in the future. It's been a very educational experience. You basically come in with no skills, and you leave after 5 years a fully trained surgeon who can safely take care of patients and make all the decisions.
Okay, just a minute. We have a call. I'm sorry I can't hear you, but can you speak up, please? And
yes, Dr. Gums. Thank you for taking my call. My question is, I was told that I needed foot surgery.
Just a minute. Foot surgery?
And I'm a person who's extremely very athletic, and I was told that I had to have a pin. My question is, how will my body react to having a foreign substance in the actual body itself? And how will I still be able to continue the stuff that I do? Like I pitch, I ride bicycles, I play football. With this, my
you're going to have a foreign body, and you want to know how your body is going to react to that. John, you want to handle that? I think this is foot, but
Yeah, we have an excellent orthopedic foot surgery department.
By tying it back to a regular surgical
Regular
procedure.
surgical
yeah,
procedure.
yeah.
A foreign body is not unusual in patients who've had surgery. Sometimes the foreign bodies are there for a long period of time, sometimes for a month or two. But patients can go about normal activities and even athletic pursuits, depending on what their doctor says.
I think the only problem you have nowadays is probably at the airport. Sometimes,
Right.
yeah. But otherwise, it's very normal activity with
Right.
foreign bodies.
Now, let me follow up Dr. Gums' question, Dr. Cosgrove. What distinguishes the Bronx Lebanon Surgical Residency Program?
I think, Mr. Schneer, we're a unique program. We really do get the best and the brightest of surgical residents, I think, in the country.
These gentlemen are very
Well,
bright.
each one of them,
Excluding these two.
Dr. Sanathan and Dr. Razi both had surgical experience before we selected them for our program. They were among 1,000 applicants for 3 positions. Not only that, they were at the top of their game academically in terms of 99th percentile scores, which is a unique program.
Another call, excuse me. We have another call.
Okay, we have another call.
Sue.
Okay, Sue, can you give us your question, please?
No, I was just wondering if what were some
Sue?
of the yes?
Can you give us your question?
Yes. No, I was just wondering about some of the complications that can occur during and after surgery.
Good question. They gave you the impression there are no complications, right? Well, what type of surgery you're thinking of, in general or?
Just a general surgery.
Okay, well, give us some complications after an appendectomy.
Sure. The most common complications which we try to discuss is wound infection. That's infection at the site we try to operate upon. You can have some amount of bleeding. Most of the surgeries nowadays, you have very less bleeding. We really don't have to give a transfusion. But for some reason, some people tend to bleed more and may require transfusion. We take maximum precautions. Most of the surgeries are done very safely. Very rarely for an appendix you could get damage to the surrounding structures like small bowel.
But mostly if it's a ruptured appendix, there's a possibility of having a residual infection afterwards.
Sure.
So infection and bleeding.
Bleeding are the most concerning.
And some pain, but pain is
we even try to minimize that with good analogies. Yeah, that's pain management post-op, and we encourage our patients to walk around as soon as possible. We take good care of them.
Now, following that question from the viewer, what should the patient look for after surgery, or their family? Is there any particular
we keep
symptoms or signs they need to look for?
So the patients are told what to look for every day after surgery. Your pain should start easing, especially day 2 or 3 after surgery. If there's recurrence of pain, we always tell them to look for certain signs of infection, that's redness or swelling, and to call back to the doctor or to come back to the ER and not take any chances.
Right.
They're constantly apprised of all the complications which can happen, and when they're given a note of possible complications which can happen, they're given a dedicated phone number where they can call and find out if they're really having a complication and they needed to come into the hospital to check that out.
So thank you for the question. Give them a little reality here. Okay.
Okay, on that note, let's pause for a short break, and when we return, we will continue our discussion as well as take calls from your viewers. Once again, the number to call is 718-960-7241. That's 718-960-7241, and please call us.
During this, our year of orthopedics, we recognize the extraordinary accomplishments of the orthopedic team. We also take pride in our new ambulatory care facility, which will include an entire floor dedicated to orthopedic services.
We have established a world-class orthopedic program here at Bronx, Lebanon. Our dedicated surgeons and professional staff offer exceptional services for hip, knee, and shoulder replacements, spine, hand, and foot surgery, trauma care, and sports medicine.
Crucial to orthopedic surgery and the operative process are the anesthesiologists.
The orthopedic surgeons depend on the anesthesiologist to keep their patients safe during the surgery. But most importantly, they rely on us to keep their patients pain-free.
And nurses at Bronx, Lebanon are taking on pivotal roles as key members of the OR team.
Our highly trained staff provides essential assistance to the orthopedic surgeons, as well as specialized care and attention to patients prior to and following their operation.
Surgery can be stressful for elderly patients or those with serious medical problems. These high-risk patients often require follow-up post-operative care in the ICU.
Our critical care physicians, in collaboration with the orthopedic team, are addressing the serious medical problems and the complications that occur following surgery.
In the Women's Health Center, screenings are performed to detect bone problems related to genetic factors and the aging process.
Our GYN team cares for women with osteoporosis for its prevention and treatment.
Many of Bronx, Lebanon's orthopedic patients first come through its emergency room.
Our staff works closely with the orthopedic team to respond immediately to injuries resulting from falls, sports injuries, automobile and bicycle accidents, and other forms of trauma to the extremities and spine.
And Bronx, Lebanon is also leading the way in internal medicine, ear, nose, and throat, surgery, neonatology, ophthalmology, family medicine, pediatrics, radiology, psychiatry, dentistry, pathology, and long-term care. Its Bronx Care Network is fulfilling the hospital's essential role as doctor to the community.
Welcome back to HealthBeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7241 with any questions you may have, and we will certainly do our best to answer them. Now let's continue our discussion. Dr. Cosgrove and our two residents tonight, we often ask our panelists to share their respective backgrounds with our viewers, and I'm sure all three of you had very interesting backgrounds. And in specific, what led you to choose the surgical career? And I'll start with you, Dr. Razi.
So I have actually always been fascinated by the anatomical aspects of various diseases,
Right.
And the fact that you can apply your technical skills resulting in immediate resolution of symptoms. I find that very fascinating.
And Dr. Nathan?
What drove me towards surgery was instantaneous results which are palpable, results which are tangible. If you really make a difference to a patient's health care, you really can make all the difference right away. You don't have to wait for a long time.
That's good. And Dr. Cosgrove?
I think the same thing, the ability to bring your skills, technical skills, to the bedside and try to have an immediate positive outcome for the patient.
Good.
Okay, some crazy guys. Dr. Cosgrove, see why I keep my paper with me? Can you share with our viewers some of the latest advances made in the surgical field, and do you have these things at Bronx, Lebanon?
We do a lot of minimally invasive surgery with...
tell me the advances globally first.
Okay.
What has happened in surgery in the last 5 years?
I think the biggest advance is smaller instruments to access the abdominal cavity to do surgery. So now we use very small trocars, which are the instruments we use to gain access, and small cameras, 5mm cameras and even 3mm cameras. So our incisions are barely noticeable on the abdominal wall. I think that's one of the biggest advances we've seen. And the resolution of the monitor is so good, we use high definition monitors. So everything is magnified and it's safe for us to do the surgery.
Yeah. Well, obesity surgery is not new, but it's improved, isn't it?
Obesity surgery has improved. It's almost all done now laparoscopically. And even the type of surgery being done is changing in obesity surgery to what's called a sleeve gastrectomy now, which is a very safe procedure.
Okay. Now, I wanted to ask you how surgical coverage in a teaching hospital such as Bronx, Lebanon works. Is it 24/7? Perhaps you can share that with our viewers. And I'll start with you again, Dr. Razi.
It is 24/7. We do have acute care coverage in pretty much all specialties. Right. And as it goes, once again, the junior residents start the process, and it goes up the chain towards the attending.
And Dr. Sainathan, surgical residents are always available to the patients 24/7.
I could not agree more. They're always there. We have a night and a day float system. There's no point in the time in the hospital where there are no residents at all. It's 24/7 coverage, and we're always there. Any trauma coming into the hospital, with the first responders.
And I'm sure when necessary, Dr. Cosgrove and his team are called in also to assist in major situations.
But they're always called in if it's an operation there's a need to go to the operating room.
And we call our colleagues in too. If we have a problem that we have a question about, it's very easy to get one of my colleagues to come in addition to everybody else.
Okay. What is the range and length of stay for surgical patients? I guess this was a plant. And what do you see as the future challenges for surgeons? Dr. Cosgrove, you want to answer that? Sainathan, you want to tell us why your patients are not going home faster? And Razi, you can answer, clean up the mess.
Well, to start, we're trying to get most of our patients home the same day. So we'll do gallbladder surgery in the morning now, laparoscopically, and the patient will go home later in the afternoon. Most of the patients we do the appendix surgery on go home the same day. And we're trying to work to get all of our patients home within a couple of days.
Yeah. And if not 23 hours,
23 hours
seems like a long time, but it's still less than a day.
That's right.
Yeah. So there is an emphasis to get patients out.
Absolutely.
Yeah.
Absolutely.
Okay. Now moving quickly into another question, Dr. Cosgrove. What are some of your patient success stories?
Well,
we always like to hear about that.
We've had many, and it's the quiet success stories. The patients who come to your office and say, "Thank you for saving my life, and thank you for helping me. I've had this problem for a long time and haven't gotten relief, and your team and staff have taken care of us. So we have many stories like that. We always try to do the safest and the right procedure for the patient.
Good.
So Nathan, you have any success stories that you want to claim?
As Dr. Cosgrove said, many success stories. The one which I remember was a 50-year-old gentleman who had an abnormal rhythm of his heart and who came in with abdominal pain, what sounded like just an infection, but we were able to find out that this was not an ordinary abdominal pain. Basically, he had a gangrene of his bowels, and he had an operation. After a successful operation, he recovered and went home well. This is a life-changing.
You have any? I don't want you to have. You're too young to have any. Let me ask a question to each one of you about how do you prepare a patient for surgery? Someone is coming in tomorrow to see you, and surgery is scheduled. What do you tell them? How do you prepare it?
So we have a process called preoperative checklist, which is basically tailored according to individual's patient needs, and it depends upon patient's age, past medical history, what medications patient takes. So we have to optimize his medical condition completely. And then,
in other words, you speak to the patient about his condition
That's correct.
You want to elaborate a little because we're running out of time.
As Dr. Razi said, is we try to know what is their associated health issues which can have an effect on surgery and see how fit they are for a particular procedure, especially from the cardiac standpoint. And if they need some workup for that, we would ask for that.
Okay. And quickly, what are the key members of the surgical team? Your surgical team, how would you?
Well, I think all the hospital staff. I certainly think the surgeons themselves, the nursing staff, the OR staff, the employees who bring supplies and clean. Everybody's a vital.
So it's a very large team.
It's a very large team. It takes a lot of people to get a patient through surgery.
Okay, Dr. Gums.
All right, I think we can wrap it up now.
Okay. Let me thank each of our panelists for joining with Dr. Gums and myself on tonight's HealthBeat television program. That's Dr. Sanathan, Dr. Razi, and Dr. Cosgrove. Thank you very much.
Sure.
And most importantly, let me thank you, our viewers, for tuning in this evening.
In the interim, if you, our viewers, have a question or need assistance, I encourage you to call a physician referral service by dialing 718-99-BRONX. That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night, and we'll see you next week.
Thank you.
Very good.
This came up.
Now the big guy comes up with that, hitting 342 with 92 RBIs and 36 homers.
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.